Chronic pain syndromes are a group of conditions characterized by persistent pain that lasts for longer than the typical healing period, often defined as 3 to 6 months. Unlike acute pain, which serves as a warning signal of injury or illness, chronic pain persists even after the initial cause has resolved, significantly impacting a person's quality of life. These syndromes can involve various parts of the body and manifest in diverse ways, making diagnosis and management complex. The etiology of chronic pain syndromes is often multifaceted and not always fully understood. In some cases, it originates from a clear injury or underlying condition, such as arthritis or nerve damage. However, in other instances, the pain persists even after the initial injury has healed, suggesting a dysfunction in the pain processing pathways of the nervous system. Factors like genetics, psychological distress including depression and anxiety, past trauma, and lifestyle choices like smoking can also contribute to the development and maintenance of chronic pain. Furthermore, certain occupations involving repetitive movements or prolonged static postures can increase the risk of developing specific chronic pain syndromes. The pathophysiology of chronic pain syndromes involves complex interactions within the nervous system. Normally, pain signals travel from the site of injury through peripheral nerves to the spinal cord and then to the brain, where the sensation of pain is perceived. In chronic pain, this system can become dysregulated. This can lead to sensitization, where neurons become hyper-excitable and fire more easily, amplifying the pain signal. Additionally, the brain's pain modulation systems, which normally dampen pain signals, can become impaired. This central sensitization contributes to the persistence and widespread nature of chronic pain. Changes in neurotransmitter levels, inflammation in the nervous system, and even alterations in brain structure can also play a role. Chronic pain syndromes are a significant public health concern, affecting millions worldwide. The prevalence varies depending on the specific syndrome, but overall chronic pain is estimated to affect between 10 and 40% of adults globally. Certain populations, such as older adults, women, and individuals with lower socioeconomic status, are at higher risk. The incidence of chronic pain also increases with age, reflecting the cumulative effects of injuries, illnesses, and age-related changes in the nervous system. Furthermore, chronic pain is a leading cause of disability, absenteeism from work, and increased healthcare costs. The signs and symptoms of chronic pain syndromes are highly variable and depend on the specific syndrome involved. However, common symptoms include persistent aching, burning, throbbing, or shooting pain. The pain may be localized to a specific area or widespread throughout the body. Other symptoms can include fatigue, sleep disturbances, mood changes such as depression and anxiety, muscle stiffness and weakness, and cognitive difficulties such as problems with concentration and memory. These symptoms can significantly impact a person's ability to perform daily activities, work, and maintain social relationships. Diagnosing chronic pain syndromes can be challenging, as there is often no single objective test to confirm the diagnosis. The diagnostic process typically involves a thorough medical history, physical examination, and review of the patient's symptoms. Imaging studies, such as X-rays, MRI scans, or nerve conduction studies, may be used to rule out other underlying conditions that could be causing the pain. Psychological assessments may also be conducted to evaluate the impact of pain on the patient's mental health and to identify any contributing psychological factors. Ultimately, the diagnosis is often based on a combination of clinical findings and exclusion of other potential causes. Chronic pain syndromes encompass a wide range of conditions, each with its own distinct characteristics. Some common types include neuropathic pain, which arises from damage to the nerves themselves, such as in diabetic neuropathy or postherpetic neuralgia. Musculoskeletal pain, which involves the muscles, bones, and joints, such as in fibromyalgia, osteoarthritis, and back pain. Headache disorders, such as migraine and tension-type headaches. Visceral pain, which originates from the internal organs, such as in irritable bowel syndrome or chronic pelvic pain, and complex regional pain syndrome (CRPSIS), a chronic pain condition that usually affects an arm or a leg. Understanding the specific type of chronic pain is crucial for tailoring the treatment approach. The treatment and management of chronic pain syndromes typically involve a multidisciplinary approach that addresses the physical, psychological, and social aspects of the condition. Pain medications, such as analgesics, antidepressants, and anticonvulsants, may be prescribed to help manage pain levels. Physical therapy can help improve strength, flexibility, and function. Psychological therapies, such as cognitive behavioral therapy, a CBT, and mindfulness-based stress reduction, MBSR, can help patients develop coping strategies for managing pain and improving their mental well-being. Interventional procedures, such as nerve blocks or spinal cord stimulation, may be considered in certain cases. Lifestyle modifications such as exercise, healthy diet, and stress management techniques are also important components of a comprehensive management plan. While it may not always be possible to completely prevent chronic pain syndromes, there are several strategies that can help reduce the risk. Maintaining a healthy lifestyle, including regular exercise, a balanced diet, and adequate sleep, can promote overall health and resilience. Practicing good posture and using proper body mechanics during physical activities can help prevent injuries that could lead to chronic pain. Managing stress through techniques such as relaxation exercises, yoga, or meditation can also be beneficial. Additionally, addressing any underlying medical conditions, such as arthritis or diabetes, can help prevent the development of chronic pain related to these conditions. The prognosis for chronic pain syndromes varies depending on the specific syndrome, the severity of symptoms, and the individual's response to treatment. While some individuals may experience significant pain relief and improved function with appropriate management, others may continue to experience persistent pain despite treatment. Recent research has focused on identifying biomarkers for chronic pain, developing new pain medications with fewer side effects, and exploring novel therapies such as gene therapy and regenerative medicine. Advances in neuroimaging techniques are also providing insights into the brain mechanisms underlying chronic pain, which could lead to more targeted and effective treatments in the future.